radiation oncologist, Dr. Luis Perez-Romasanta. Dr. Romasanta not only works at a hospital in Spain that treats coronavirus-infected patients, but he himself also has been diagnosed with COVID-19. He joins me now from Salamanca. Doctor, how are you feeling now?
Well, pretty well. I've been 2 hard weeks here at home, separated from the job and from the family. But right now I am pretty well. I'm improving.
You said you've been home for about 2 weeks now. What did it feel like when you were first diagnosed?
Well, I felt very sorry from the point that I had to leave the hospital in a situation where every help, if possible, is needed. A lot of patients were coming to the hospital and were hospitalized with more or less severe symptoms. And I felt really very sorry not to be able to give a hand in that situation. And the second feeling was also of worry, because I could transmit the disease to other people, to co-workers, to other patients, and even to my family. So I was pretty worried about that possibility.
I'm wondering what type of symptoms you showed.
Well, initially I felt very tired, with some sore throat and some cough. And then I felt I had some fever, not very severe. And finally I got no sense of smell and taste, and some shortness of breath. That was the most scary symptom, I think.
I'm wondering if you could sort of tell me and our viewers what your treatment was like. Were you just sort of put in a hospital bed and put on a ventilator, or were you given any medicine, or did you actually say your symptoms are fairly mild, just go home and rest, you have a strong immune system?
Yeah, exactly. I have only been treated with paracetamol, so my symptoms were mild. I didn't need any ventilation, any oxygen, so I could be at home. And my primary care physician was calling me each 2 or 3 days to be sure that everything was okay. So in some way, I was really fortunate.
Are most cases in Spain of patients who are showing mild symptoms of COVID-19, are they being treated with some sort of paracetamol?
Yes, most people is at their own home, and they only receive that type of supportive care or symptomatic treatment. About 20% need to be attended in the hospital, and they become hospitalized at the end. About 5% are hospitalized in intensive care units, but most people can surpass the disease at home with mild symptoms.
So basically, a paracetamol, I believe, is a temperature, is a fever reducing drug, and then you take the paracetamol and you let the body's immune system kill off the virus then, right?
Yes. For people with no previous diseases, with no morbid conditions previously, usually it's enough to restrict yourself at home, to rest a lot, to sleep a lot, and to take some pills, some paracetamol or ibuprofen or aspirin, and that is usually enough to overcome this situation.
Okay, as a doctor, I'm wondering if you could give people out there some advice in terms of when or whether or not they're showing symptoms, when they should be going to a hospital, when they should be going to a clinic, what they should be doing if they feel that they're showing symptoms.
Well, probably the best thing to do is to pay a phone call to your daycare medical center and they have in place a system that can triage your situation, so they can give you advice to stay at home or to go to the emergency room in the hospital or to wait for the doctor visit at home. So probably the best way is just to follow the indications of the national health system, and the first thing to do is to phone call to your medical services.
Okay, doctor, you work very closely with dozens, perhaps hundreds of patients. Can you sort of actually go back and pinpoint the specific time when you said, I may have actually contracted the disease from this particular person or this particular patient?
Well, we had a patient in the hospital with some respiratory symptoms, and finally we asked for the test, and the patient gave a positive test. So that was on a Friday. So on the weekend, I began to feel weak. And so on Monday, when I went back to the hospital, the first thing I did was to ask for the test, because my suspicious was that I had acquired the disease. Yeah.
Okay, but you're a doctor, you're at a hospital, you're wearing personal protective equipment like gowns, like face masks, like gloves. Despite all this protective personal protection equipment, you contracted the virus.
Well, we didn't wear any specific protection with that patient because he was not still diagnosed with coronavirus pneumonia. Since this patient gave a positive test, then the rest of the personnel began using all that stuff. And the patient was moved to a different floor in the hospital. But during, I would say, 7 or 8 or 10 days, all the personnel that attend that specific patient didn't take specific protective measurements to protect from the coronavirus.
Okay, I also want to ask you this question. You were mentioning at the beginning of our conversation that 80% of those people who get infected with this virus will most likely show mild symptoms and they will recover, make a full recovery. When you look at the numbers, we have over 500,000 people globally infected. About a quarter of that, 125,000, have made a full recovery. How quickly do you think people who have made a full recovery can sort of make a step towards going back to a normal life, start interacting with their loved ones, perhaps when these strict lockdown measures are released, they can go back into society?
Well, to recover of the symptoms is not enough. You need to be tested again, and you need to obtain a negative test in order to go back to work. For the health system personnel, they are asking right now for 2 consecutive negative tests in order to go back to the hospital. So recovering of the systems is not enough.
All right, Dr. Luis Perez-Romasanta, thank you very much for joining us here on the News Hour. I really appreciate your analysis, a great story, and I wish you all the best. Stay safe, stay healthy, and good luck with the fight against the coronavirus in a country that's very heavily affected. Thank you.
Thank you very much.